Welcome to our live show with Rajwant Kaur Singh. And we are live for our live show called Heart to Heart. And there's a reason why we called it this way, exactly. And it's not because it's Valentine's soon, although that could be a very good reason as well. So I'm Christina Garidi, and I have founded Eudaimonia with a mission to propel people to live authentically. I coach ambitious professionals and entrepreneurs to decode their purpose and find career alignment. To really do that, I introduced the Eudaimonia success model as a TEDx speaker in 2018, and I am writing my book on how to access the eudaimonic state of mind. And for those of you who are wondering what on earth is the eudaimonic state of mind, it's a Greek word, it's a philosophical word, and it really means human flourishing. And it's really the ultimate paradigm, I believe, for well-being. And it has been forgotten for a long time, unless you were into the languages at university or into philosophy, you wouldn't have come across it. But Aristotle has wrote extensively about this, probably 2 millennia ago. And I think this needs to change. Here we are. I'm the host of Eudaimonia live show, and I showcase brilliant people, in my opinion, who lead with Eudaimonia. And today I have Rajwant, who is our guest. So Rajwant Kaur Singh is the CEO of Children's Heart UK, the national charity championing children with heart conditions across the UK. Rajwant is a charity leader with over a decade of experience championing accessibility, inclusion, and social impact across sectors. And how relevant is that now, more than ever? Rajwant has continued to strategically develop and program design and creative production at a range of national organizations, including the Whitechapel Gallery, Tate, that we all know of, the Architectural Association, Rosetta Arts, and the Royal Household, which is very close to me in Windsor. She also serves as chair of the board of Concrete Youth, an organization dedicated to enhancing the lives of people with profound and multiple learning disabilities through cultural provision. Give her a round of applause. So today's focus, really for our live show with Rajwant, is Rajwant's ability to create life-changing impact for people she's serving, of course, as part of the causes she actually champions and supports, but not just the patients or the beneficiaries. What really stood out for me was how she really thinks of the holistic ecosystem of their families, of the wider support systems, such as the hospitals, the medical professions, but also the workplaces, the employees and the employers of those families. And in the times that we are living, we often feel powerless to influence the status quo sometimes. And I definitely, watching some of the news on social media, I don't own a TV, but if I'm following anything, it kind of makes me feel, oh, I feel I have no say in this. And we forget what personal agency really can do. And Rajwant shows us how you can channel it effectively, no matter what your background may be, how young you may be, she's very young, or your perceived influence from wherever you may be in the societal or the organizational roles you may have held. Welcome, Rajwant.
Thank you. Thank you so much
Yeah.
for having me.
Yes, and you are joining from Birmingham today. You were there for a meeting in the morning, weren't you?
Yes, I am. Hello from Birmingham. Very great Birmingham. Thank you so much for such a wonderful, warm introduction. So excited to have a heart-to-heart with you, Christina.
Thank you. And without further ado, I'm going to say to those of you who are joining us and who are already liking and so on, feel free to ask any questions. We will pick them up and we will present them to Rajwant to answer. If we do forget or we cannot fit it in, then we'll definitely answer it afterwards, so feel free to share it. So let's get started. What inspired you to study architecture, which it seems completely relevant with what got you into this journey, right? What happened along the way?
So far removed from everything. I don't know how I found myself on this path, but I like to think we're led by something bigger, guided all the time.
Mhm.
But yeah, it was, even studying architecture was a journey for me. I think growing up, I can't talk about that era of life without acknowledging, like, I didn't actually think it would be possible for me at many points to go through university or further education, because of, yeah, I guess cultural intrusions and other things. It wasn't something that naturally fell in my path, but I knew I wanted to learn about the world. It was a combination, I think, of all the things that I was interested in terms of art and design, and just geography, I guess, and people and places, and that coming together, and the intersection of what happens in spaces, and how things make you feel. And that emotional thing always was a big part of why I chose to study architecture. But I didn't actually know or think that I would ever get the opportunity to go to university. I went throughout my schooling life knowing it would come to an end at some point. And then, yeah, after a long battle, it opened up, and I made a really rash decision. I was always very dedicated to academia or studying. I very much saw it as a pathway to doing whatever you could or wanted to do. But I didn't know I wanted to study architecture. I just knew I was going to get the maximum. At this time in my life, it was like points that they graded it on of whether you could go to university. And I would see all my friends
Yeah.
kind of choosing. And growing up for me in East London, we didn't really have, like, career pathways or even people to look up to. I was the first one in my family to go to university, the first one in my school set to kind of further education. And so I could see people have really, like, dedicated, knowing what they wanted to do careers. And I was like, wow, good for you. But that was never my journey. So I actually had these points, think about all the things that I was liking, interested in, wanted to do. And I said to myself, okay, I'll grab a prospectus, whatever it opens up on, I will
Wow.
explore that further.
Risk taker.
it was risky. And it opened on architecture, which I'm so grateful for, because it really it was delving in, I think, with something that is as vocational as architecture. You don't really get a preparatory period for that. You kind of have to go in and know what to do. And I think that has definitely set the tone of my career since then, of, like, being able to be kind of chucked in at the deep end and have to navigate and figure out and learn as you go and be exposed to new and different things, which it very much was. But then moving along, I was kind of really then started to look into, and I say this to people all the time that I speak to, especially the young people that we're engaging with all of the time, like, kind of explore what you're interested in, but also take time to really see how you feel and respond to that, and lean into where your interests are, and take the opportunities that come towards you. So for me, that was very much about, like, the creative side of things, which, as you've already said, I've pursued in other ways. And so I was really interested in studying this intersection between art and architecture and people. And that kind of scratched away at that for a really long time, practically, and then moving over more into the, like, strategy thinking. I think the one thing that kept on coming up across those different sectors and opportunities was this idea about accessibility and who is engaging in these spaces and who feels welcome here and why, and what are the inequities and why can I see this so clearly, and how is wider society addressing that, and how do we make people feel like they belong and had advocacy and are able to get involved in things. And so that has kind of led me down this weird career path. But it was, it's definitely been something that, no matter where I've gone, that route of understanding, okay, who feels like they can take ownership here and who really feels like they belong, is something that has stood out for me along the way, and carries me now to Children's Hearts UK. So that's where we are. I don't think I answered your question at all, but
You did. I absolutely am at awe at how that intersection of art, architecture, what is practical, realistic, and all the considerations that go underneath it opened up that door for you to start this trajectory. An architect is an architect. I mean, the career path is very much predictable. You open an office, you become a good architect, you connect with, I don't know, construction companies, developers,
Yeah.
And you get commissioned to do, I mean, I'm not trying to reduce it to this, but technically, I guess when you were young, that may have been, something that you could look up to if you finished your degree and hope for.
Mm.
But actually, you took such a different trajectory. And obviously, as a career coach, I'm very much interested in this. And what I
Mm.
hear is that accessibility perspective really opened up something important for you, which was to consider the access, the advocacy, the belonging, how people feel in these spaces, and not just because of the building. I mean, that was the excuse, but in general.
Yeah,
And how you take that
100%.
forward. Wow. Um, Next question is coming. So,
Okay.
really, fast forward to today.
Mm.
You have no medical background, and I don't mean it in but technically to take up something so important, heart conditions, right? A charity that really deals with complex heart conditions, and I'm sure you can let me into the stats. Um, but really, meaning and purpose had other plans for you, took you here. What acted as your invitation, perhaps, or as your wake up call to really take on this role when your background technically was not the perfect paper background with all the credentials and so on? I'm not judging here. It's more about it's so alternative, but actually it was the right one. How did that kind of
100%.
land, and how did it feel when you took on the challenge?
Yeah, absolutely, Christina. I have major, major imposter syndrome about that. And I always say, I
Mhm.
say to my team and pretty much everyone all the time, I just feel like I need a new dictionary every day because there's so many new words and, all of the medical kind of terminology, but then all of the acronyms and this whole world, it feels like absolutely something else. But I think, again, just trudging along that, the kind of career path that I had. I got involved then after working in arts and architecture in different galleries and then different alternative spaces for exploring. So I worked previously in like alternative education provisions and then supported a charity in East London where I'm from who looked at kind of arts as a mechanism for social improvement. And it kind of became second nature to me to learn about the behind the scenes business side of charities and all of that good stuff and what happens and how to create it and how to make and create spaces. And by that, I don't mean like physical spaces as an architect, but more of the kind of emotional spaces where people feel like they can use tools to become who they want to be and explore who they are. And there is not one method or mechanism for doing so, but actually just being who you want and feeling that. And then it got to kind of there where I was, the charity that I was previously with had secured a really good, amazing opportunity to create a new space architecturally, a new creative wellbeing space, we called it. And at that time, I was kind of like, okay, I feel like comfortably I can leave this in capable hands and know that it's going to be okay. And I think, we all have that in the back of our minds of the legacy of the work that we do and what does that look like. So I was looking for other opportunities and this role came up and absolutely I was like, no, I do not know anything about the medical side of things, but I knew about the business side and the charity side. And most of all, first and foremost, the people. I knew I could do the people side of things. And I looked at the charity and I'll be transparent and honest with you in this conversation that it was, needed help. It was in danger and it needed some support. And I really felt like I could actually grab it with both hands. And I was quite maybe too strong when I was going to interview
Better
for the
than lose
role. Yeah.
than maybe fall.
Yeah, if you let me lose, I kind of, said to myself, if I really got stuck in and gave this my all, what could happen and could we save it and could this And I think, you know, a lot about the motivation behind the people we support. So you mentioned about the stats before. It's 1 in 100 children in the UK are born with a heart condition. So it is the most common defect present at birth in the UK. And so the numbers is, you know, between 5 and 6,000 newly diagnosed children a year. And they're just those that are born with heart conditions. There are lots, many other children who then acquire heart conditions in infancy or in childhood or even teenage years. And it was that people, that switch of being like, well, what will these people do if we cease to exist, or if the charity isn't there, and how does that happen? And it's definitely been a learning curve in terms of the medical background. I'm not by no means there yet.
You don't
But
have to, because you're not on the forefront, you're not doing the operation, you are there to
exactly,
support
yeah.
the whole ecosystem in what they need. And that's what I love about the work you do. You didn't just look at the beneficiary or the child who's suffering from, of course you do work with that, but it's all the, sorry.
Yeah, no, I think it's been a really, I try and be as open about that as possible. So I
Mhm.
was a child with a health condition when I was younger. I spent a lot of my early years in hospital, but not heart related. And I try and always, you know, whoever I'm speaking to, whether it's yourself or funders or, you know, news or the children and families and people we support, is that I don't know what they've been through. And so I really like made that the core of my starting. So we set up multiple different ways where we can actually always ensure that we're kind of listening first and foremost, but also responding to what the contemporary needs now are of children and their families and carers and parents and that whole, you know, world that wraps around them, and what their needs are now and how they're changing. And I guess since I joined as well, it's just been a mammoth of change, you know, we're seeing in the healthcare service and above and beyond that. But also it's helped me to be really aware and learn about, okay, what is that holistic support looking like? And okay, the service is brilliant, is, you know, needing in so many ways, but ultimately is brilliant. But there is so much more to care than just healthcare, and that's where we're trying to look at and make a bigger difference now as we go into the future, hopefully.
Yeah. And it does take money, and you know, charity
Mhm.
sector is not necessarily the most well-funded sector. You are young and in an industry that is reliant on people's goodwill. Exactly on that point, right? The business side of things is not the most sustainable that there is, according to my limited knowledge on the charity sector, and I've worked in the charity sector before. As the CEO of this Children's Heart charity, what keeps you awake at night?
I'm not that young for a start.
You are.
So that keeps me awake. Just knowing that I'm
You
getting
look
older.
young, so
No, I'm getting older. I've definitely aged. But no, I think going back to what I was saying previously is the support that we provide. I think even in my awareness of charity, I was really ignorant to how much, particularly in healthcare, there is such a reliance on the charity sector to support services that you might think already exist or should exist. I'll give you one really practical example. For example, so Children's Hearts UK, we provide information on heart condition specific in children, and then also kind of management or lifestyle well-being information to support, okay, how to have a healthy life for your child with a heart condition. And that ranges from things like feeding to things like, you know, being independent, going into your teenage years, you know, maybe perhaps starting a period, all of those things that have different implications when you might be living with a lifelong life-limiting heart condition as well.
Mhm.
And it's things like that. I think without us, that information wouldn't exist. And where do people go? I think it's so obvious. So I wrongly assumed maybe that like the healthcare service would have that kind of information, and things would be available around that, but there just would be nothing. And so that abyss keeps me up at night, and it's constantly like, okay, what is the next challenge? I mean, we're having massive conversations now around mental health and physical health. We're in a beautiful place where we are seeing, thanks to advancements in science and the dedication of the care service, and I don't want to undermine that at all because everyone works so brilliantly hard, but we are now moving into, in our area of work, congenital heart disease, a 90% survival rate into teenage life, which is incredible. But it means that there is now this cohort of children and young adults who are facing things that they've never had to face before because they've never survived before. So on the one hand, it's wonderful, but on the other hand, it kind of brings a whole new like dynamic to the conversation of like different life, for want of a better phrasing, issues they might encounter. And it's just constantly keeping up with like, oh, okay, but what is that? Like the actual service provision is quite lacking and is quite one-minded in terms of it focuses on very much the physical health, the palliative care in terms of, stopping that medical process or prolonging any, severe outcomes. But actually, there is a whole nother physical, mental well-being aspect to it that isn't looked at and isn't addressed. And then obviously, the business side of things is very much, the funding, how can we raise the profile? I talk a lot and we've spoke already about the numbers, but actually in terms of awareness raising, I think there is a lack of visibility on children, heart conditions in children. And I don't know if that is stigma related and just, that change in general like cultural awareness of being able to be more open with healthcare conditions and different ways of living and different people and being more accepting of that, I hope, in the future as we move forward. But also how are we gonna get to next month? What does that look like? Where is the money coming from? How are we gonna do what we do and make the best impact and the biggest change and support for children and their families that are managing with this?
Yeah. No, and this is a reality of every charity, I believe. It's not like, somebody's going to give them billions and it was like, don't worry for them. Actually, in the midst of, as you described, having to be next to those families, hear it from the horse's mouth, and actually supporting those young adults going into real life with perhaps a condition that's not enabling them to be at the fullest of their health, or there's certain risks. I'm sure heart conditions must be some sort of correlated to stress, or they get aggravated, in the way that normal life has to be at those paces that we have to live at. I'm sure it's not necessarily the easiest, conditions to take care of. And you were sharing when we spoke last time about how you make sure you support, people with more difficult questions that young adults wouldn't be able to ask their medical doctors, for example, or the parents, or you end up being the cushion, the blanket, the middle, I guess, foam that softly supports those inquiries, without judging and without kind of utilizing it towards something, because the medical professionals will need to do something with it, but it wouldn't be an emotional support necessarily. I think that's huge. And I really think it will be nice to share your contribution as to, okay, you have to do all of this, but also you've achieved something really, really, I believe, major recognition in your field of work. And I think you know what I mean. If you don't, then clarify.
That's okay.
What did it take to bring that here to the UK today? I mean, we are in 2026, and I would have, in my very simplistic mind, assumed that the UK, being the UK, would have taken care of these things.
Yeah.
And I'm going to shut up and allow you
Thank
to
you.
tell us.
So I think you're referring to a legislation change that we made last year, but it's it's a constant battle. And I think, and like you say, I think maybe we assume that because of where we are and how developed we are, that there is a system in place that supports life and people. And I think, I can't put this down to only myself, but definitely for me and parents and carers and family members or support networks who also are kind of chucked in at the deep end at this work with no prior understanding or knowledge and awareness of the system or the way it goes or how it works or what the right thing is to do is. The most important thing that and creating the spaces to have those conversations has been pivotal as well, but is to just ask sometimes, like, why or why not? Why does something exist, or why has it always been that way? And just because it has always been that way, does that mean it's the right thing to do? And being able to be brave enough and, you know, have the courage to ask the stupid question, quote unquote, or whatever it is, it's been what has led to us making change. So yeah, we were able to make some legislation change last year, and again, it's just kind of listening to, okay, what is the you know, there is a diagnosis or something happens, and what is the actual like domino effect on the lifestyle of the people who it affects. And again, that will obviously be the child, but also their care system, their support network. It can go to the schools, and we're doing things around making change there. But also in the healthcare service, we've still got lots of things that we want to change, and things that we're still questioning, you know, why. And I think the process has been, yeah, first of all, understanding, asking. For me, at Children's Hearts UK, and for us, it's really, really important that we're not adding to any inequities that we're already seeing and hearing. So we do a lot of due diligence and work to ensure that, you know, what is the status across the UK, and is it the same, or are there pockets where, you know, things are different, or are there pockets where there is exemplars where things are going great and we can really learn a lot from, and can that be replicated across the country so that everyone can have, you know, access to what seems sometimes to you and me probably like common sense, but oftentimes it is these laws and systems that have, you know, were put in place at a time, or, you know, we're over 75 years now there in the healthcare service, and, you know, maybe it was that way when it first started, but life and everything has evolved and moved on so much, and maybe it's never been looked at again, or it hasn't been questioned. So then to ask, be in the places to ask those questions. And we've done a lot of work to build those bridges. So as a charity, we actually sit on something called a clinical reference group, which is like basically interrogates in the best possible way, constructively, within the NHS England about the care congenital heart disease as a healthcare sector of provision. And through that, it means we are able to advocate for and also amplify the voices of the children we support. And that's really important, that we are kind of always making sure that their needs, their concerns, their questions are on an agenda and raised in those meetings, even, as you say, sometimes when it is uncomfortable and when healthcare professionals might not know how to answer things. But if that is the experience of the people we support, we have a duty of care to make sure that that is known and that is addressed and improved, hopefully, for the future. And so, yeah, it's a lot about muscling in and and asking those asking those questions, and then finding out, you know, nationally or in the system ecosystem that this, you know, an issue might exist. Okay, where's the scope for change, and how far can we push this, and how far can it go? And oftentimes, and I think we're really fortunate to be in wonderful networks of, you know, not only heart conditions, but also in children's health and well-being and schools and education, and there's wonderful work going on across the sector in wonderful ways, and so we'll always try and bring as many people as possible along with that. And if we can make a change in cardiac care, you know, can that be replicated in other areas or specialist services, or what does that look like, and how can we make the biggest impact possible, you know, while making these tiny shifts. And oftentimes it is like a change in wording, or, you know, a tiny, maybe like, you know, green tick that unlocks a whole new world and gives such a sigh of relief to so many people. It just, yeah, it makes it worthwhile. It makes it worthwhile, but it's being brave, I would say, just to have those conversations.
Thank you so much for sharing this. And I love what you said about, you know, how you make it happen is really, you just have a fight, you know. I love it. It comes down to being able to be brave, to muscle in and say, why is this happening here? And why is there? And being, you know, unpleasant at times, shall
Yeah,
we say.
yeah. I think often for, you know, like myself, or you know, parents, carers, families, children and young people, we just assume that there is, you know, that the system exists because it is the right way, or we just assume that there is like a hierarchy. And actually, I think, you know, oftentimes we take out the humanity of that, because of the infrastructure that's in place. When I think when we have those conversations, and when we do, because we're motivated by the work that we do find the courage to ask. People do relate to that, and they respond to that on a human level, and they want to help. And it's, okay, finding your allies and people that can see the benefits and the impact that changes can have, and then the safety in numbers and working together and collaborating to make it happen. But I think sometimes it's that fear of the the infrastructure, or the fear of the name, like, taking on the law, or taking on the healthcare NHS. It is scary, but there are humans doing wonderful things all around the world, and connecting with that humanity, I think, is what helps to change the lever sometimes.
Mhm. And may I say, it's not, it's not the clinical or the university academic work that can change so much. I mean, it can. Um, but here we're talking about Rajwant and her team and her wider networks working together to change the legislation to allow, if I'm saying this correctly, um, parents with children who have heart conditions to be able to take legal leave from their work in order to be able to attend to their child's life-threatening surgery, for example, and not having to worry that they're going to lose their job tomorrow because that landed on them when they had, their first child or their second child. It doesn't matter. But I mean, if that allows parents to be able to support their children, be there, imagine what that means wider, for health conditions. I mean, I had a couple of close friends with parents who, have cancer, or the other way around. It might be anyone. It might be your partner having cancer, or, that household. How is it going to cope?
Mhm.
How is it supposed to attend on a condition that it's so life changing, and it needs an entirely different gear up to attend to, while holding a job and being mentally stable to do so, while you're going through, is my favorite person going to live or not through
Yeah.
this?
Yeah.
um and I just want to bring the emotional side. And I love how, it's very easy for systems and, structures, hierarchical structures, perhaps legal structures, to look at things as black and white. But what you said about equality doesn't mean we just look at everyone the same.
Mm.
The argument is, can we put all the nuance possible so that it is equal for different people in different situations, so that they can actually do what they need to do? And of course, we've talked about before about the disparity you've seen across different hospitals in different geographical locations, let alone if we take that globally, right?
Mhm.
Even in the UK, it was quite shocking for you, right, to
Yeah,
see
that
that.
was really
Yeah.
hard for me to, just as an outsider to this world and as a human. And I always say to me and my team, a good day at work for us is not always an easy day at work for us. And sometimes it is having that ability to really listen to someone's struggles, and you feel it. You have to be their strength, but you feel it inside when they are, you're hugging a mum because her child's just going into surgery, or you're speaking to someone on the phone who's crying because they can't afford their medication, or they're stressed about how they're going to take two other kids to school while they've got one in hospital, and all of those things. And you connect with that, and you feel that as a human. But then it's our place to be that strength and say, okay, there's change here that needs to happen, and what do we need to do to make it so that this doesn't affect people anymore? And it's those, sometimes seemingly simple things that would make such a big difference to that family, that child, that their whole life, that it really is bizarre to think about sometimes what what you're hearing and what you're listening to. But yeah, it's not easy.
Not just the child, is it? Because you're telling me about really having to hug the mom or listen to the dad, or, the wider family that cannot support, their child the way they want to or they hoped for. This is so important. And where does the charity scope end, right?
Yeah.
Um, so-
Yeah.
yeah. Thank you for sharing this. And tell us a bit more about what you're working on right now, and how are you approaching it differently to other leaders, because you're not a traditional charity leader. You have such a diverse background, and you used it in beautiful ways that I wouldn't have thought is possible, even as a career coach. But now that you shared it with me, I'm like, smart. And I think that will help, the audience understand that transferable skills. I mean, I'm reducing it to transferable skills right now for language purposes and career coaching purposes. But I think, it's fascinating how skills and experience can be translated in different contexts in such a powerful way. So tell us a little bit more about what you're working on right now, and a little bit more about how you used certain things that, I wouldn't have thought, like the spatial recognition of belonging, and, into virtual spaces, or into emotional spaces of belonging as well.
Thank you. That is such a big compliment. I don't know what to do with it.
No.
But I think it is all about what I was saying before, maybe about being really open to being new to this world. And so creating those conversations. And I think, the charity has existed now for almost 40 years. And as a change manager, or, someone in leadership, is quite difficult already to come into that space and say, okay, I can see some things I'd like to do. Does this feel right? And so a lot of my early work in the first few years, months, feels like years, was around, okay, first of all, visiting everyone, meeting as many as people as I could meet. And that meant, the children, their families, their healthcare professionals, our wider, charity support network, and everyone in and around that. And just really taking time to listen and understand, okay, what's going on? What are the experiences? Where are the barriers? And what is our scope to help? And that is always a tightrope of balancing act of budget and funds and, all of that good stuff.
Yeah, the business is to do it technically, but then you
Yeah,
have to.
exactly. I want to do all of this. So then really, thinking strategically and distilling our work into 3 key areas was big for me. So we work under now 3 headings: so recognition, resources, and research. And then it was looking at, within those areas, what is already there, what is already great, what can we improve upon, and what might people, as I said, need now and going forward in the future. And actually, I think having the benefit of working across different sectors, or multiple sectors, has been insightful, because I know what's going on in the architecture space, or the art world, or advocacy elsewhere, or other charities. And so for me, coming into this healthcare charity space, it felt, and this is just a personal opinion, but it felt to me really archaic. It felt really behind the times. I couldn't understand why we weren't moving in certain ways, or why things weren't available. So a lot of our initial work has been around addressing some of these inequities across the country. And that's things like, the information we provide, is it accessible? Can it be more accessible? We're now doing things like translating it in different languages. Ideally, I'd love to have like visual representation. I think just understanding the way people understand, read, acknowledge, digest information now is so different than it was 40 years ago when the charity first existed. And are we still making sure we're responding to that? And are we still, making sure this information is as accessible as it can possibly be? One of the major pieces of work that we did was a rebrand. So we were Children's Heart Federation for 40 years. We're now Children's Hearts UK. Please follow us on everything if you can. But that in itself has been, again, just addressing, okay, for me, it was a reputational risk, and really looking at who we want to be and what our values are and what people are looking for and how they can connect with us now and continue to do so in the future. And it's those kinds of things, like making it as easy as possible to find support has been massive. I think I can say it until I'm blue in the face, but unfortunately, when someone finds out that they have a diagnosis or something is going on, all of this work becomes complex. It becomes difficult. It becomes hard. It's, you can't underestimate the peaks and troughs of being able to navigate that journey. And so it's really been a lot of our work, and with the rebrand particularly, it's been about making it as easy as possible for people to get the support that they need, in a way that feels approachable to them. And I think also recognizing that oftentimes, unfortunately, it's those who feel entitled to ask for help that are the people who receive it. And so how can we, be help outside of that kaleidoscope community? How can we be there? And so changed a few things, like, for example, making our helpline 24/7, just small changes and adjustments. That means people can talk to us when their kids are in bed. We now have a team of nurses that work across the UK so that we are visible. And then looking at, the fun things, the resources that people ask for. The one major thing that we're asked for still now is, can I connect to somebody else who has been through this or who knows what I'm going through? So we've got like helpline buddies. We do lots of events and activities and opportunities to connect people together, whether that is regionally or whether that's because they have the same condition or they have children of the same age. And we always need help with like volunteering to make those opportunities happen. We took over Legoland last year, getting people out of hospital and into making memories, right down the road from you. And then seeing, okay, that's what people are asking for now. What could help going forward? And we spoke already today about, like, having that growing population and what that looks like, and the different things that they might be navigating. And then from my experience in other sectors as well, it's like we're doing a project at the minute where we're supporting VR headsets in all of the level 1 cardiac units to help with relaxation and distraction, but also rehab and recovery, and thinking, okay, how can technology kind of support people, and what is happening elsewhere in the world that we're not tapping into yet, and how can we bring that on board? And I do all of that, but then I'm always really humbled because we have these open communication with the people we support. And I had a conversation with our children and young people steering group, who are representative of children, different ages, different conditions across the UK. And I was like, okay, blue sky thinking, like let's brainstorm. What would you want in a support package and a support tool? And in my head, I'm thinking, all the technology and new games and iPads and trainers and I don't know what, but I just said, go for it and let's see what we could do. And then, they come back to me and they say, actually, we felt really bad for disturbing the nurses to ask for knives and forks, and we couldn't get warm. Can we have a blanket? And we needed things like cotton wool and towels that weren't available. And you think, oh, okay, this isn't hard stuff. This is basic, and we can help with that. So just continuously making sure that there is mechanisms and ways people can talk to us and tell us about what is going on for them and how that might work. But then a lot of it, as I said already, addressing the kind of physical and mental side of things as well is a new conversation for us, but one that feels really overdue. So hopefully we'll be able to make some bigger moves around, the mental health and mental impact. And we know the implications on mental health of living with a long-term health condition, but it's hard to help when everything is limited and what that might look like. So there's so much we're working on, Christina, essentially.
No, I was going to say, how do you possibly, humble business analyst over here, I'm thinking, how do you create all these customer journeys and how do you track where everybody is at any one time? It's like, sounds so complex. And the mental health piece is huge because it's not just the patient, it's their family as well that might be prone to, of course, not getting the support they need. Because how do you support a mother whose first child has a condition like that, or the father? It might be the father, or it might be the auntie. I don't know, but we don't know these things, and this is far from what scientific research would cover or would ever be able to provide for. And the cross-disciplinary combination, maybe it's not the right word, but being able to see across all disciplines and be able to see how they're linked is what you definitely bring into this. And this is so important. And the most important also thing I keep from what you've been saying all along is we listen.
We
You
try.
don't even get close to, you might want to have the most posh package, as you said, a support package, but actually the reality was they needed cotton wools, towels and blankets to warm themselves, right? Because they were careful of not burning out the nurses who are also working overtime and so on, and the communication line after are at school so that parents can share
Yeah.
their worries without their child knowing that mom is worried about me and she doesn't know how.
Yeah.
Absolutely huge, huge, not just progress, but important and valuable support that you are offering that is hardly, I would think, before knowing you, the scope of a charity to do.
Mm. Yeah.
Um, but you're taking this all on, and I
Which
don't know how you're doing that. So people, if you want
uh,
to know how she's doing it, you
yeah,
know where
it's
she is.
I think it's interesting as well when you kind of, like you were saying about knowing everyone and where they're at in their journey. You kind of get so connected to people. It feels like second nature. Like even my board, we had a board meeting over the weekend, and even my board was saying it becomes more like a family. You know, it's not that we are us, the charity, and they are them, the people we support. We are together on this journey of change all the time, and we stand side by side and we help support one another in terms of, you know, if someone can't do one thing, there'll be someone who can do it, and we lean on each other and we get through it together. And I mean, particularly now, it's really difficult in terms of navigating, you know, the changes in the NHS and what does that look like, and all of these systemic changes ultimately. But it's distilling it down to like, well, what is the impact on that as a person, and how are the people, the children we support, knowing what's coming next or what that looks like for them. And they're terrified because they were supposed to have you know, surgery this year, and they've changed their GCSEs once, and you kind of like, you just hold all of this because you care, because it comes from, you know, this is our family and we're not going to let them down, and we're not going to let them go through that alone. And so it just, yeah, it just
Wow.
melts together.
Yeah. And, you know, there is, I'm going to mention here, there is a fascination about data points. And I think there's a, you know, wonderful, you know, thing of trying to create systems that are intuitive, that are led by data and all of this. But what you mentioned is so, so much more important. That emotional connection, the family you have created with all the network. And by network, I mean the patients, their families, their nurses, their medical professionals, you know, and of course the wider, you know, educational or connections with the legislation or the clinical, you know, uh, group that you are part of. Um, it's it's all good hoping that, you know, there is one way of managing all of this and automating all of this and being
Mm,
able to see the you know, predict perhaps what's coming up or not.
yeah.
But there is so much more, the fundamental part of actually being emotionally connected, because that catches more things than
Hmm.
what a system would, and what a data point would mean, and, you know, how you can connect faster than perhaps, you know, a procedure would,
Yeah.
not a surgical procedure here, but a process would, you know, these requests.
Yeah.
And going native into this and being there and listening is probably the most underrated skill
Yeah.
that there is. And so many leaders, you know, just to juxtapose it as well, would be, yeah, I'm leading my team and I'm listening to my direct reports, but actually 5 levels down, carnage is happening. um,
Hmm.
you never know about it.
Yeah.
It just makes me think direct and accessible sometimes is so much quicker and better.
Mm,
But of course, it has its limitations in terms of, you know, scale. Um, but
yeah.
this is an eye opener. This is truly
Yeah,
an
it's,
eye.
it's a lot of honesty. I think, you know, just being honest and saying like, I actually don't know. And then hopefully people be honest in those communications back. But I always say, you know, I'm not young enough or cool enough to know their experiences or what they're going through or what they might need. But it's really, you can't actually quantify the value of just really being truthful and connecting with someone, and how that pays dividends in weird and wonderful ways. For example, we had a call the other day from someone who we knew in our network, and obviously we're a children's heart charity, and that means we support people up until a certain age, and that's great and wonderful and needed. But we had an adult call us and just say, "Oh, hi, I just wanted to let you know, like I've had a baby, and you helped me when I was X, Y, and Z, and I didn't think this would be possible, and I just want to say thank." And I was like, "Oh my gosh, so nice to hear from you." And
I
just
put a
being
price to
like,
that.
yeah, that in itself meant so much, just to know that somebody has felt supported by us and been able to, go on to different things in their life that they didn't feel emotionally feel or physically feel would ever be doable, possible for them, is invaluable.
Wow. Wow, wow, wow. And last but not least, it's Heart Month. Is that
It
correct? In your
is. It's
charity?
Heart Month.
Yeah.
Happy Heart Month.
Tell us more about what you are doing as the frame of this, of course, month for your charity.
Yeah, so Heart Month is every February, and it culminates around actually Valentine's Day, which is CHD, Congenital Heart Disease Day. So really a day of awareness that we take to stand on our soapbox, as we do every day, and raise public perception and awareness that heart conditions can exist in children, in adults from born, and they look different in everyone, and that's okay. We try and theme it differently, but actually in line with our conversation this month, this year, we're focusing our Heart Month activity around the idea that it's good to talk. And so opening up conversations and again connecting people, and we're hearing from some really wonderful people across the month within our network who, for myriad of reasons, may not have spoken about their condition before, may not have felt they were able to, may not have encountered reason to, but have been brave enough and bold enough because they feel it's important to raise awareness that this happens, and it is actually the most common thing that will happen in the UK, and it's important to talk about. So we'll be hearing from lots of people across our social platforms sharing their stories, many for the first time, many in different ways, many in different backgrounds, some you might never expect in a million years. But I think even that, whether you come from a cardiac world or not, it's always, for me anyway, inspiring to see people, taking ownership of their story and sharing what they've been through in different ways, and hopefully it can unlock anyone to be brave and be them, and that will be a beautiful thing. So we're celebrating Heart Month by talking.
Beautiful. And no accident that our talk is called Heart to Heart. And if we intentionally open up our heart to someone, how wonderful that can be for them to be able to share their experience, whether it's the same or similar or different. But, there's always a bridge that can be built when we share from the heart. If you loved Rajwant's, talk to us as part of the Heart Month today, you might want to connect with her. So make sure on every channel that you are with us today, I will put her details and, of course, the handle for the Children's Heart UK, which has rebranded. Rajwant, thank you so much for sharing, first of all, real examples of impact, how you, as a leader, bring humility, but also connection to your wider family, and how you treat this business. It is a business. You are working there as a family, and how you are managing, the resources, the research, as you said. And what was the first one?
Recognition. Thank you.
Recognition.
Yeah.
As part of running a business that's not guaranteed funding, that's not guaranteed recognition always, or visibility, but how you do it in powerful ways that defy what's possible in the charity sector is huge. Thank you so much for sharing this. And of course, if you want to support a charity this month or for the rest of your life, why not choose Children's Heart UK? Thank you
Thank
so
you,
much for
Christina.
sharing.
Thanks for having me. Happy Heart
And
Month.
yes, happy Heart Month. And if you need any support on how you can use your heart as a compass in starting to make a difference, this is the woman who can give you a little bit of a nudge and definitely listen genuinely to what you have to share. So thank you so
Thank
so much.
you. I'm so grateful. Thank you.
Thank you too.